Good afternoon, everybody. We begin with the 11th session of the Alumni Engagement Program 2021-22. And today we have Dr. Riddhi Shah with us, who is now lovingly called as Dr. Riddhi Shah Shea. She is a PG graduate from Sancheti College of Physiotherapy. Dr. Riddhi has done her MPT in Cardiopulmonary Sciences. Therefore, the topic for today is pursuing MPT in CVRS PT in Sancheti Institute, sharing her experience. She's also done her graduation, undergraduation from Nagpur Medical College. She has done immense work during the COVID times in terms of ICU rehab, COVID, post-COVID rehab, which we are looking forward to know from Dr. Riddhi much more about it. And something which is very, very commendable during her PG days, that is her dissertation work, was on translation and validation of the Hindi Borg CR10 scale. So definitely we would like to know a little bit about that as well. And Dr. Riddhi is also a certified therapist in cardiac rehab and managing respiratory diseases. So we welcome Dr. Riddhi Shah, and we may begin the session. Hello, Riddhi.
So hello, thank you so much, Sarojini ma'am, for such a warm welcome and such a nice introduction. And hello, I would say my dear ones, my colleagues, or just a family, a Sancheti family. It's really, really great to be part of such a huge family. Everyone, when I go out, you are just called as Sanchetians, and it feels really proud of that. So first of all, let me just give a little bit introduction about myself. I am Dr. Riddhi Shah, and I am a cardiovascular and respiratory physiotherapist. And when I say this, I say it very proudly, and very proudly more because I've done it from Sancheti College of Physiotherapy. So today, we are just going to, I'm just going to share a little bit of experience of myself, and I just hope by listening to it, you also feel proud, and when you are out, you will just take that as a end note that it's so good and proud to be part of Sancheti and to be working as a cardiopulmonary physiotherapist. So as ma'am said, I have done my graduation from Government Medical College Nagpur, and then I did my master's in cardiorespiratory sciences from Sancheti Pune. Like you all, while I was also in final year or a third year student, I was also with the same के cardiorespiratory में होता क्या है, सिर्फ breathing exercise or chest percussion or vibration देना है, cash पढ़ लेना है, and then you are done. So the KIDA, I would say, for the cardiorespiratory sciences started while I was doing my internship. So in my internship at Government Medical College, there is a lot of patients. We see so many patients every day, but there was very little exposure. I wouldn't say zero, but very little exposure of cardiorespiratory patients per se. We saw a lot of ortho patients or neuro patients, but cardio were very little exposure of that. So I had thought that I would parallel to my internship, I joined one hospital also. I used to go in the evening. And I thought that while I have to choose my elective, I should be clear and open about, okay, I should know that what each and every elective has to offer me. So I had joined one hospital. It was New Era Hospital. It's a multi-specialty setup. And there my work more involved working in an ICU. So yet again, I'll mention this. The therapist who was working there was from Sancheti. I won't take her name, but she was also from Sancheti, and she really motivated me, and she really, I think, that Kida was planted because of her only, I would say. So yeah, I would. So while working at New Era, I started going to ICUs, and then I started treating those small babies, neonates and pediatrics, and I saw such fancy machines, ECMO. There's one machine called as ECMO, extracorporeal membrane oxygenator. So these terms were really new to me, and I was like, okay, इसमें भी physiotherapy होता है. So that was an eye opener for me. It's not just breathing exercise and what we do, a little bit chest percussion and vibration. It's a lot more than that. And the more bigger aspect was we work as a part of a team, that all the anesthetists is involved, a nurse, a physiotherapist, the doctor, the treating surgeon, everyone is involved. As I was saying, so yeah, it's not just only percussion and vibrations. As I saw that it was a team approach, and that what that what something started in me, that something like this I want to do. I want to be a part of a team. I want to work. I want to do a holistic approach on the patient, and it's so much good when you see the results of the patient. It's the doctors also say that because of physiotherapy, because of say a simple breathing exercise, so much difference a patient's outcome has been. There's so much of the difference in patient's outcome. So yeah, while I was working at New Era, at that point I was like, hey, this is something I really want to do. I want to be part of a huge hospital team. I want to work with so many doctors together. I don't know. I'm not blaming anybody, but I just don't want, never wish to just do simple knee exercise or back exercise. I wanted to do something which is involves some critical setup, some some fancy setup, I would say. So yeah, that was a thing, and there was also a lot many pulmonary rehabs which we were doing on OPD basis. So I think that was a kick for me, and yeah, so then I gave my masters, and I would really like to mention this while I was preparing for my PGCET. We all make those to-do lists, and we write that what are we supposed to do, and there's the topmost heading which college or where we wish to do. So on my list there was written Sancheti College of Physiotherapy. So that was for sure that I wanted to go to Sancheti, and by God's grace I got into Sancheti and the field which I wanted, that cardiorespiratory sciences. So let me just really brief about the experiences which I had in Sancheti. So I was from a government setup, and when first day I went to Sancheti, it was like really posh college because of the white walls and so much cleanliness around. So being from studying from a government setup, that felt really like, there's one more batchmate of mine. We were like, my God, this is what something a college life looks like. And when we used to go to wards and rounds, and when I used to see a third year student who knew better basics than me, like in government setup, what happens, there's so much involvement in treating patients that somewhere I think uh, I don't know if we don't focus on basics. And here at Sancheti, I would say all the students are very much good at basics, the basic academic knowledge, and all you all should be very proud of it, first of all, because all the teachers take a lot of effort to make your basics very clear. You have to treat patients, but then you don't have to forget what your bases lie at. So I used to really get complex with the third year students or the final year students, because I felt that they know better than me. And then that's when the journey started of uplifting myself, of driving hard, because now it was the time that I got what I wanted, and now I have to make full justice to it. So then, and all the teachers, Simi ma'am, Razia ma'am, how they are constantly behind us. Like when we were batchmates and when we were students, so the cardio people were the most on toes people, I would say. I'm not, no offense to anyone, but the teachers were such, they were used to all constantly keep us on toes. We have to take this seminar, you have to present this case, you have to do this. So we never were at a backseat. We were always like, aaj ye karna hai, kal ye karna hai, aaj ye karna hai, kal ye karna hai. So that really always kept us on edge. And I would say that is the attitude we still carry. You cannot be sitting on backseat. You are a doctor. You have to do justice to your patient, and you have to constantly keep on trying to do better. So I would really appreciate that, both Simi ma'am, Razia ma'am, Prajakta ma'am, everyone used to keep us so much on toes. And that really helped us. तभी ऐसा लगता था कि यार एक संडे को भी रिलैक्स नहीं मिलता है, रिलैक्सेशन नहीं मिलता, बिकॉज कुछ प्रेजेंटेशन बनाना है, कुछ करना है. But now you realize that, that is needed. That is needed. You are a professional, you are a doctor, and you are treating with someone's life. You're dealing with someone's life. So there's no sitting back. There's no relaxing. You have to be on your toes, and you have to constantly try upgrading yourself. You have to constantly try reading papers. You have to constantly be on toes, improving yourself. So that really helped. So I think all the postings which we get at Sancheti to the Sassoon se leke, Wadia Hospital ho gaya, and all this. There's a Hardas Heart setup. So all the setups gave us different aspects of society. Also, I would say, because at Sassoon you see different class of people. When you go to NM Wadia, you see a different class of people. When you go to Hardas Heart Care, there's different set of people. So it really prepared us to deal with all kind of patients, because patients are not going to be, you cannot choose your patients. You have to deal all patients. So this thing really helped us to get accustomed to all kind of, see, I am a Gujarati and I was really bad at Marathi. But then when I used to go to Sassoon, I cannot talk in Hindi. There were patients who didn't even understand Hindi, forget English. So, I have to constantly improve my Marathi, and my friends used to really laugh at me that, what kind of Marathi are you speaking? But then somehow you have to if you want to get patient's history, or you have to explain your therapy to the patient, you have to talk in the language, and you can only connect if you talk in your patient's language. So I had to learn Marathi. And now while I'm practicing in Gujarat, so I have to because I'm from Maharashtra background, there is a little bit few words of Gujarati also I don't know. But then, if you really want to connect to a patient, you talk in their own language. So that will really. Okay, so that's what it was all about. So you need to overcome those language barriers also to connect with your patients. And at Sancheti, because you got so many different hospitals or postings, I think that was pretty much sorted out there. And then coming back to the presentations, coming back to the research, I would say. So I think research is one thing which really molds you in some different way, because it's not an easy task. Believe me, it's not an easy task. I published in this year, 2022. So I've been trying since 2019, 2018, I would say. And then it got published in 2022. So, that is not an easy task, but it, I would say, molds you in some different way, because you learn so many things, right from deciding your own topic to actually executing it is a journey in itself. And I would really, really thank Razia ma'am here, because if she would have not been behind me since so much, it would have not been published, believe me. Simi ma'am also, because she was my guide first, and then she had to go to UK. But then thank you, Razia ma'am, because she took over my research, and then the way she supported, the way she guided, and then till date, till the date it was published. So I really, really thank Razia ma'am for it. So, your teachers at Sancheti are really I would say, the guiding points for everything, right? From your research to your different postings, to your cases, to your presentations. So I would say presentations was a really, for us, at some point it was pain in ass, but then also it gave us so much of confidence. Now, if I have to talk anywhere about any topic, so I remember once we had gone to this workshop where we had to demonstrate our airway devices. So because we have taken so many airway devices classes of final year, third year students, so Radhyaman just told me that, Riddhi, you speak in front of everyone. And I was like going in a flow without a stoppage, because we have so much of experiences taking your lectures or taking, lectures of final year, third year students. So there's no going back now. We can just talk about anything with confidence. So that is really a good thing which we learn here, and it stands out when we are working. It really stands out because whatever you say it with confidence, and your treatment is confident treatment. Your attitude is with confidence, so it really makes a difference. So now I would say all this, the from Sanjay, the education we got from Sanjay, the guidance we got from Sanjay, everything. When I came back to Nagpur and I joined Kingsway Hospital, everything was, now it's time that you have to be in toes, you have to be on your toes, you have to actually work. Abhi tak sab theek tha that you are a student life, but now you have to be a professional life. Your professional career when it starts, then it's a different journey altogether. But it was a beautiful journey, and the year I joined, that year was a COVID year. So altogether, it was a different year for everyone, and it was a different year for me also. But it was a tremendous learning year, I would say. So when I joined Kingsway, I'll share a few experience of Kingsway Hospital now. So the major milestone was in being a professional what I am right now. I think Sanjeti is there because that has molded me in a particular way, and after that, Kingsway Hospital really played a big role because the things I dealt there was altogether has raised me to some different bar. So I would say at Kingsway, how we do is, in the morning, we have 9 o'clock rounds, and each and every person, right from an intensivist to a nurse to an RMO, physiotherapist, dietitian, psychologist, everyone is there. And a patient is treated, uh, it's treated with the entire team. It's a holistic approach. So there's a plan of the patient for that day that you have to how you have to treat that patient through that day, what is going to be the outcome. And it's a team approach, and that's what that is what is important in a patient's outcome. So I would say that was really encouraging. That was really a proud moment when you work with that entire team. You realize what is your position. You realize how you are making difference to that patient's life. So when you actually see the outcomes happening, it's a really it's a feeling in itself. And so yeah, I would just show a few videos. I would also show a few videos from my COVID times. And then that COVID time came, which was a hell of an year for everyone. And just like every other family, even my family was skeptical whether to send to hospital every day. But then at that point, I just took one day at a time, that let's see. And every day when you are on that other side, when you're on that hospital side, see, the anxiety out was different, but when you are actually on the side of dealing those anxiety, that is altogether a different thing. So, every day there was some new thing happening, that itne cases are, itne cases isko ho raha hai. And when your colleagues start having COVID, that time you really, really get scared. But then you still, that something was keeping going on inside, that you have to keep going, you have to keep going. Unless you are being affected with COVID, everyone was coming and everyone was like, you have to give your best. So I think I'll share a photo of me being a COVID warrior. Just a minute. Okay, so this is me. This was actually my first day entering the COVID ward. So yeah, like everyone, even I was dead scared. But and wearing this PPE, how will we manage? treating patients in such a huge PP suit, and it was a day in itself, I would say. But when I entered the COVID ward, and when I saw those patients, and when you go inside, as being a doctor, so I was like, no, it's you have to do it. Come on, you've got an opportunity. You have an opportunity of being a warrior. You have an opportunity of being on the front line, and why not? Let's just help these people in any which way is possible. So yeah, that's what keeps us motivating. I'll just share a video where we made a elderly patient walk. Just a minute. It's taking a little bit time to open the videos, but I really want you all to see this. Okay. So this is me and one of my colleague. I hope it's visible to everyone. So yeah, this is me and one of my colleague inside the COVID ward, and he was an elderly patient, and he was not on any oxygen support or anything. But see, what we used to do in COVID times is everyone used to say that active COVID hai, zyada kya karoge? What can we do being physiotherapists? But there are just it's not only chest physiotherapy maneuvers which we can do, but there's a lot of functional rehab which we need to do, because these patients are so much bedridden. So they're it's not only their physical problem, it's not only the problem of the lungs, it's a problem of the mind also. And you need to keep them motivated. You have to keep them being motivated that okay, you are there, you can reach. It's just a matter of days and then you'll be out. So till then you have to keep them motivated by doing a little bit of functional rehab also, that we used to follow. We used to uh, make the patients walk, we used to make the patients do marching, we used to make the patients do sit to stands, and a lot many things, group activities, because in COVID they had a lot of bondings with the patients nearby. सब बाजू बाजू के लोग सब एक साथ मिलके they were like a family together when they were in the wards. So there were so many group activities going. So yeah, that was one thing which was a motivating factor for them. Okay, so this was the time of COVID times, and there was a lot of learnings, I'm sure. And everyone, I think, who has worked in COVID, they all have their own journey, and they all have their own learnings. But I think one note which I made, that you know uh, just take life as it is, and whatever whatever opportunity comes your door, don't go back. You have to grab it. I know everyone was scared in the COVID times, and even I got COVID in that time. But when I got the opportunity, there was no going back. You had a chance to serve your country, a chance to prove what you work. And I think it was the biggest time where at least the cardiorespiratory physios felt so much proud. All the people have done such a tremendous work, such a splendid work, and we could actually prove ourselves that what we do and how does it change a patient, a person's life. And not only COVID, after COVID, there was so much of extensive post-COVID rehab. There was so much of mucormycosis. I think you all have heard about black fungus. I've seen so many young patients, 30-year, 25-year-old, they've been dying from mucormycosis just because that black fungus was affecting maybe the sinuses or something. But, so whatever you can do for this patient was a blessing and was a proud moment for each one of us. So I think it was a very testing, as well as very gaining too much of experience in itself. And one patient I would really like to share was my patient he was there from active COVID to the time I have, made him do the weights. I have seen him through that journey, and really he had cried in front of me that, madam, agar aap nahi hote to kya hota mera. And when you see this response from your patient, at that time you feel that what work you are doing is really a proud work. And it's just, don't take this field, I would just say that it's just mere breathing or mere chest percussion vibration. It's a lot more. You deal with patient on everyday basis, you deal with their mental health, you deal with their all the aspects. You have to connect with the patient. And when you see such a progress, when just ATMs would drop the saturation from 90 to maybe 70 or 79, and now he is doing weightlifting and not dropping the saturation. That's a tremendous work. And how do we do it? We do it with an extensive rehab. We do it with a planned rehab. We do it with monitoring. We do it with our own basic knowledge of our own subject. So yeah, you just have to follow that. And of course, research, and that's there. I mean, you have to stick to the research, whatever new things are happening. So I think what I learned best was you have to see the patient, you have to see what condition he's at. सिर्फ एक्सरसाइज देना काम नहीं है, मॉनिटरिंग काम है, एक इमोशनल एक मेंटल सपोर्ट देना भी हमारा ही काम, बिकॉज यू आर handling that patient on everyday basis for 2 times BD sessions. If we do 3 times, we do, so you're seeing that patient 3 times a day, 2 times a day. And so you have to, I was not focusing only कि मुझे आज इसको इतना इतना exercise कराना है, नहीं. What is his condition right now today? It's more of monitoring rather than just prescribing exercises. So I think all therapists need to know that it's not just prescribing exercise or just prescribing a few rehab. It's about monitoring more, that what is patient's condition today, and accordingly, maybe yesterday he did better, but today he's not into that state. So maybe I will not give such an extensive rehab today, So yeah, I mean, that was a key point. Now I think I'll share a few videos of from my hospital, and we'll discuss about it. It's going to take a little bit time to open, but yeah, I want to show you what equipments or how we do the rehab. It will be a stepwise, and you'll get an idea. Sorry, it's taking a little while, but I don't know. Okay, so this is my team. I would say the they are the relative is sitting in front of the patient. So see, you see in the picture that the patient is attached to a ventilator, the patient is sitting, the relative is sitting, and the entire team is standing behind. So, when a patient is in the ICU, how much it affects its mental health, you cannot even imagine, when they don't see their relatives for days together because of the condition. Maybe they are unconscious, maybe because in ICU, relatives are not allowed so much. So, just to see a relative or just to sit on the bed, that is itself a tremendous, I would say, joy in itself, and a tremendous activity for them. We talk about METs all the time. We talk about, that your daily activities are 3 or 3.5 METs. But to achieve that 3 or 3.5 METs for these patients is an task in itself. So, am I visible, or the video is not there? Okay. So yeah. So I wanted to show you this photo because it's such a happy photo, because the patient is on ventilator and the relative is sitting. And I know that day that how much happy that lady was when he saw his son. He was his son. And because we've been trying to make her sit, she is a quite healthy lady, and it's difficult to make him sit. But this is what we use is a Paramount chair. Paramount is a company, and what the yellow thing which you can see is movable. You can actually detach it, and then you can adjust it to patient's circumference. So yeah, I mean, that's how we start with an ICU rehab, that just making a patient sit is a task and it requires a team. And when you actually do it, it's a joyful movement. Oh, sorry, it's a joyful moment for the patient and for the relative. So I really wanted to show you this. And now I'll be showing you different rehab things, what we do. So now I'll share another video. Okay, so can you see this? This patient is just doing a simple spirometer exercise. But you know, this simple exercise, how much impact does it make on your lungs? You all must understand that this is a very effective exercise. To do it correctly and to make sure that your patient does it correctly is very important. So this client was on HFNC. It's called high flow nasal cannula. And so why we used to use HFNC was because your mouth is open. If you use your NIV mask or something, your mouth is closed. So therefore, you cannot administer spirometer, which is very effective for your opening of the lungs, for preventing atelectasis, what we say. So therefore, this HFNC was widely used, and hence we could give him a spirometer. So just reclining your bed, if he cannot, ideally he should sit straight, but then they used to have a lot of backache or something. So we modify the positions if you want to. And the way we have kept the table, if we cannot hold it, or if you cannot hold it when you're working in COVID also. So that's how you modify a little bit things, but just a simple modification can make a big difference. And to choose between your devices, whether to go for an NIV or HFNC, because if he needs to do this exercise, he has to put into such a device where your mouth is accessible. Okay. So yeah, that's how it is. Now we'll move forward to another video. Start the report. Okay, so now again, this patient is also was put on HFNC, and we are making him do marching on spot. So these are basic beside the bed activities which we make the patients do, which will really help him to be functionally active. And also it really stimulates their mood, their overall behavior, their overall emotional strength, I would say. So when they see themselves at least standing up or doing lifting their legs, it's itself an emotional feel good factor for them also. So that's how we do in that's what we do in ICU rehab. That's what is included. But see, only giving exercise, as I said, is not important. Monitoring is very much important especially while working in ICU. So constantly there's a check on your heart rate, your blood pressure, your saturation levels. And the moment it fails, there are limits to it. You don't go below the limits. So for a therapist to be working in ICU, this thing is very important, not just giving exercise, but monitoring, I would say. I would really stress on monitoring. I know I've been talking a lot on it, but yeah, I strongly believe that monitoring is a key point while working in ICU. Okay, so now we'll see another video. Okay, so now you can, in this video, you can see the patient doing sit to stand. This is a very good exercise for ICU rehab because it challenges your quadriceps muscle a lot. And we think that it's very simple, ke bed ke sab utna hi hai, but you yourself do it 10 times and you'll see the effect on your quadriceps muscles. So in ICU, we have to modify because, you cannot take a patient to some, you cannot take a patient to some equipments or आप उठा के उनको ले जाओ OPD में, आप उठा के उनको कहीं ले जाओ. You have to, whatever you have to do, you have to modify your rehab between in the beds only. around their beds. So that's what, and you have to also focus on your muscles. You have to focus on at least your major group of muscles, and quadriceps is a major group which you focus for your lower limb. So that's how you modify your treatment, your plan of action, because this is important. And you know that in when a patient is bedridden for a long time, which is really the case for ICU patients, so there's so much of wasting, there's so much of disuse atrophy of the muscle. So we prevent that. Only the ATMs, or once the patient is out of that stage of in bed activities, you can actually take him out of bed. You can actually do such movements. You can uh, ask the patient to sit on a chair beside. So that will help him for functionally be mobile also, which and help, of course, boost तो होगा ही उनका confidence, but एक functionally active होने के लिए ये सब चीजें बहुत important है. And again, yet I will stress on all the aseptic precautions, because see, the patient is on a T-piece. So the what do you say? The T-piece should be absolutely sterile, I would say. It should not be बहुत जगह हम देखते हैं, especially ससून में, तो कफ भरा रहता है और पूरा बलगम भरा रहता है. So that should not be there. First, you do your chest physiotherapy, you do the suctioning, get the cough out of the patient's chest, and then you do the functional rehab. This is very important because if your patient is already coughing, then obviously his activity will be reduced. He'll constantly be coughing, he'll not feel good, he'll complain that nahi hoga mujhse, mujhe bahut khansi aa rahi hai. So it is very important to do your breathing and chest physiotherapy maneuvers before any of your functional rehab. It will enhance also the efficacy, and that's how you do it. That's the better treatment, I would say. So now we move ahead. Okay, so I wanted to show you this video. It's called, this is the bedside cycle which we give. So, many patients are not able to come out of bed because of obviously their physical limitations, maybe physical as well as the pulmonary limitations. So what we give is, this is a in bed cycle, which will help to keep their, to prevent the disuse atrophy, I would say, to keep them functionally active. It will, yeah. So, and also this doesn't involve too much of effort from the therapist side also. These are all the simple maneuvers, but it really makes a big difference in a patient's outcome, in a patient's rehab, and yeah, in overall patient's outcome and life, I would say. So yeah, this is just a simple in-bed cycle, which you could see. I'm just holding from so that it doesn't get displaced. Okay. I'll be showing you another video now. Yes, ma'am. Okay, so this video is really close to my heart, because this patient which we've been seeing was on HFNC, and he was a long-term COVID, because you can see his age, he was quite elderly, and the way we weaned him. So I have seen him from COVID to non-COVID to progressing to OPD, for post-pulmonary rehab also. So this was the day when out of, I think after 65 days, he came out of the ICU and saw this scene. So, just talking about the numbers, can you just imagine how he must be feeling? And, when he got that fresh air. So in our setup, we had kept this lobby area, which was accessible from the ICU only. So there was a little passage through which we could go to this outside lobby area. So this was for, because when the patient is a long-term ICU patient, how they don't even know. They have this, they don't even know what time it is, whether it's day, it's night, kitne baj rahe, kya, they don't have any idea. And when you take them outside in fresh air, that boosts them in some other level. And the way he recovered after this, he is right now on high flow mask. When the video goes back, you can see it. He was on a high flow mask, and I think within a day or two we weaned him to the nasal cannula, because it really improved his progress. So this is a very important factor in rehab, that you have to, you have to not treat him like a patient all the time. You have to understand what will you be feeling when you will be in his place. जब अगर आपको मैं 60 days के लिए एक आईसीयू के अंदर बंद कर दूं, आपको ना दिन ना रात किसी का कुछ पता नहीं, when you at after so many days, when you go actually out in fresh air, how will you be feeling? It's, you are reliving your life again. So I really wanted to share this because it was really it's really motivating to see this. Okay, so now this is the final video of the day. So can you see that a lady is doing some craft work? Now, why I am showing you this video is because being a therapist, we just focus on exercise and we focus on functional rehab and everything is right. But, such activities, there are studies which shows that, such crafting activities really uplifts the mood of the patient. So in ICU, it's not only just about the strength and not only just about the functional rehab and not only just about chest physiotherapy and breathing exercise, everything is involved. Can you see? We have done so much of varied work, not a single video just has simple breathing exercise. I have not included only such videos because I know you all are doing diaphragmatic exercise, segmental exercise, आप सब करते हैं. पर आप क्या ये सब करते हैं या ये सब देखते हैं routine practice में? No, but this is a part of your rehab. That's why I wanted to show you. This is just a simple coloring activity. And the video has shown that it was a doctor's day and that lady had made such craft things and she had given it to all the doctors, all the treating doctors of hers. So it's such a great feeling and such a proud feeling that being on, first of all, that lady is so motivated, being on bed and HFNC with so much of oxygen support. She is doing such activity. She's thinking, she's giving it a thought that she has to gift something like this to her doctors. So it was really an overwhelming moment. And it's only breathing and physiotherapy and suctioning. No, it's altogether a different world. It's just how you see it. There are so many of research papers. We give music therapy, we give laughter therapy, we give such crafting activities. These are all your mood boosters, and that's what you need in an ICU rehab. It's just not only just strength ki bhai inko, you have to get that patient out of that zone that is called as something, you must have heard that there's something called as ICU trauma also. They suffer from ICU, I'm not getting the right word, but they suffer from ICU trauma, being in the ICU for so many days. So yeah, that's what you do. This is the last video of the day, and lastly, I'll just show you my team of doctors, and that'll be it. You are seeing the Okay, so this what you are looking here is a team of doctors, and not only physiotherapists, is a full ICU team, what we say. There are doctors, nurses, intensivists, physiotherapists, dietitian, psychologists, everyone is a part. RMO, surgeon, treating surgeon, everyone is a part. So, this is the feeling of working as a cardiorespiratory therapist in an ICU, that you are a part of a team, a teamwork. And when a patient recovers, the entire team is being appreciated. It's not just one person. We all are being taught, that it's just not one person's job. It's a team approach, and that's what it is. And you learn the values of your teamwork and your, how do we work together with the colleagues and with the entire part, how it feels to be a part of a team. And it really feels great. I must tell you that it's good to be a part of such a team, to be working in conjunction with your doctors, surgeons. You also learn that how you need to portray yourself as a physiotherapist to the doctors, to the surgeons. And, you have to tell them your value, the value of your profession. And when they see your work, they will appreciate you. तभी वो प्रॉब्लम नहीं आता है कि हमें डॉक्टर का डेजिग्नेशन नहीं दिया जाता या हमें डॉक्टर जैसे ट्रीट नहीं किया जाता. You show them your work and they will appreciate. So therefore, working as a part of a team is very important, and it's a feeling in itself. So I think I'll end my session here about my journey. So this was all about working at a Kingsway hospital, and what all things I learned, what all things what things I have done at Kingsway. Because we working in so many different part of our PG program has really given us so much of confidence and so much of experience that we can go to a surgeon and we can talk to a doctor and we can explain them that it's not just this, there's a mechanism behind it and why we are doing this. So I would really like to thank college faculty of Sancheti who has molded us in such a way that now what we are is because of the alumni. And on the ending note, please, if you really like working, treating in a critical atmosphere, working in a team, and proving yourself in front of doctors, in front of, in front of a team, then please don't just feel that cardiorespiratory is just breathe. Don't have that misconception in your head. It's so much more than that. I've shown you so much rehab videos, what all practices we do, and there's so much still research going on. So don't, be in that bubble that it's just breathing. It's just limited to your cardiorespiratory system. It's just not limited to cardiorespiratory system. It is entire body. We are treating right from head to toe. So it's just elective, but then you are treating from head to toe. Yeah. So yeah, thank you, ma'am. And if any questions, I will be pleased to answer.
Yes, definitely. First of all, thank you, Dr. Riddhi. Thank you so much for sharing with us. The note on which you started off with, that is the gratitude towards your alma mater, Sancheti College of Physiotherapy. I think not just the cardiorespiratory department, the entire college is very, very proud of you. Especially the immense affectionate work you have shown during COVID times at the workplace you were working at. And I think as a young budding cardiorespiratory physiotherapist, it's very appreciable that at this such a young age, you are so passionate about what you're doing. And I'm sure after this talk, a lot of our current students are definitely, I'm very sure that that after listening to this talk, many of them will be motivated to take up CBRS in their masters.
I really wish, I really wish, and I really want all you to be out of the bubble that what cardiorespiratory is. It is a lot more, and we are treating a patient from head to toe. It's not just the
Definitely. And I think COVID has really given us that opportunity to showcase and use the skills we have got during masters doing cardiorespiratory therapy. Anyways, so one of our students just wish to know a little more about the research work you've done, because translating the Borg scale, which we so commonly use for our patients. So one of our students wish to know that what kind of motivated you to take this project for your research work, for your dissertation work?
Okay, so I think Borg, we all routinely use it, and we all know that it's a subjective scale. अगर आप ससून में जाओगे, अगर आप उनको English बताओगे very hard, so they will not understand. So that what, and I think Razia ma'am really, I think she was the one who really budded this idea that why don't you translate the scale? Because while I was searching for the topic and I had so many other on my plate, so like, can you see that there's a dearth of facing problems on everyday basis? People are not understanding because it's a subjective scale. The patient is supposed to understand, and it's not in their own language, so it's really difficult to explain them. So that motivated me. So I thought, being the most common language in India, I thought that let's just start with Hindi. And yeah, I mean, that was the motive behind it, that for the ease of patients' understanding of the scale.
Right, very rightly said. And I think on this note, also like to add what you mentioned about your last video, use of art and craft as a rehabilitation, as an alternate therapy. So I think, I'm sure, along with the clinical skills you have inculcated in your master's program, I'm sure the research aspect of
I think this.
extremely sorry about the technical issue in between. So I was just telling about our students that I'm sure that from your talk, they have also realized that not just the clinical skills, but of course the research aspect is what you have inculcated during your masters, as you showed in your last video about the art and craft based alternate therapy, which also helped your patients to cope up and to come out of the ICU as soon as
Traumatic
possible.
ICU, yeah.
Right. So with this, I think, again, I would like to thank on behalf of ASCOP, our Alumni Association, College of Physiotherapy, and the entire college. And we are really, really thankful, Dr. Riddhi, for your precious time which you have given to us. And we are hoping to get connected once again in future to talk more about your current work. I
Definitely.
think you're currently based at Ahmedabad. So
Yes.
where exactly are you working right now?
So, after Kingsway, last year, because I got married recently in December, and I've moved to Ahmedabad now. So currently, I'm working with Mission Health. Mission Health is a fitness come rehab plus physiotherapy setup. They have I think they're opening the 7th chain here. They're opening the 7th setup. Sorry, their chain based in Ahmedabad only. And a very proud moment that the founders of Mission Health, Dr. Alap Shah and Disha Shah, they are also alumni of Sancheti. So still different aspect of cardiorespiratory. So you're it in dealing out your
Perfect. Internet.
we focus your all the post pulmonary rehab, post COVID rehab, cardiac rehabs.
Thank you so much, Riddhi. I think you are working with our senior alumni, Dr. Alap Shah and Disha Shah, which you just mentioned.
Yeah.
And we wish to connect with you soon again to discuss and share about your latest work profile. And of course, the amount of information you gave to us about the field you have chosen, and the I think we all need such passionate physiotherapists like you. And thank you for choosing Sancheti. So I guess the feeling you have for your alma mater is totally mutual. We feel the same for you. And we wish you good luck for your future endeavors. And we hope to connect back with you again with another talk on the specialization you have chosen.
Thank you so much, ma'am, for giving me this opportunity. And with all the busy schedules, still finding time to finding the best time which suits me, and really grateful to be connected with Sancheti, because even today, if I was in Nagpur, now I'm in Ahmedabad, but still here I'm still connected to my roots. So it feels so proud that wherever I'm going, the roots are there. So yeah, I'm really thankful, and warm regards to all the teachers and everyone at Sancheti. Yeah.
Thank you, Riddhi. Thank you once again.